This is big breaking emergency news. We are now seeing the Biden administration and the CDC are now implementing new rules similar to 2020. We are now seeing 2020 health rules being applied now to hospitals and medical facilities are now being issued new rules by the CDC and Biden administration. And this could be the start of a similar thing that we saw. And the timing of this is very coincidental. So let's get into all the details here. Really quick, guys, please just hit that like and hit that subscribe. I'm posting multiple videos a day, keeping you guys updated on all this big urgent news, and it just helps to get these warnings out. I appreciate that. All right, so this is what's going on with the CDC. Also, multiple hospitals in New York are now implementing mask requirements. They are now requiring people to cover their face if they enter any of these medical facilities. This is happening in New York right now, on top of the CDC issuing this nationwide rule update for hospitals. Hospitals are now going to be required to report any types of respiratory diseases or illnesses, specifically flu, the 19 that we saw, and RSV, are specifically being told by the CDC that hospitals around the country now have to track and monitor these diseases and give the CDC updated numbers on these diseases right now. There's also a lot of other protocols that they have to adhere to now too. They have to report any supply inventory shortages, staffing shortages, all these things. There's a ton of rules and regulations that the CDC just put on hospitals relating to these respiratory diseases. So what's going on here? All right, the timing of this could not be more strange. It says here that updated hospital reporting requirements for respiratory viruses. This is a alert that's just been put out by the CDC. Okay, it says that earlier this year they stopped mandatory reporting of these respiratory illnesses, and they're now implementing mandatory reporting of these numbers and also of a whole host of other things that are going on inside of the hospital as well. Right, they're clamping down on these medical facilities, and some medical facilities in New York are actually already wearing masks. We will get to that details of that in just a second, but it says here that the Centers for Medicare and Medicaid Services has also issued a new rule in coordination with the CDC and the critical access hospitals around the country to report information about these three diseases that I mentioned a second ago. It says, through the National Healthcare Safety Network, CDC will work with hospitals to provide training and technical assistance to ensure they are ready and able to meet these updated reporting requirements this fall. This was just issued on August 23rd. The CDC put out this alert to August 23rd, 2024, to hospitals, and it's now just getting out to the public, right? We are now just seeing these rules that have been implemented. It says here that they will be required to electronically report information like confirmed infections and bed capacity related to these respiratory illnesses. And it says it will be on a scheduled specific date by the Secretary of Health and Human Services. It says they also will have to report things like confirmed infections, total bed census and capacity, both overall and by critical hospital units and age groups, limited patient demographic information, including age. All right, so they need to know your age, they need to know all the stuff. They're forcing hospitals to report this now. And this is the start of this. And it's also the start of the medical side, the insurance side as well. Okay, insurance companies are also ramping up for this too right now and are taking into account these rules and are starting to collect this data too. So what's going on here? Something's going on. It says limited patient demographic information, and it also says that hospitals will have to report, quote, facility structure and infrastructure operational status, emergency department diversion status, any staffing shortages, any supply inventory shortages, things like equipment, blood products, gases, right? And also relevant medical countermeasures and therapeutic inventories usage or both. So this is kind of big for the CDC to be requiring hospitals. This is going to cost them a lot of money just documenting all this stuff and going through all their inventory. And they're going to have to hire someone just to report all this data to the CDC, right? And they want to know all these things. This seems like the beginning of something bigger potentially, right? Who knows? We will see. Hopefully not. All right, stand strong, stand firm. Whatever happens, stand firm and be prepared and be ready. But it seems like this could be the start of something big, right? They wouldn't just be forcing hospitals to do all these regulations for nothing, okay? So they're even getting into their staff, all this stuff. This seems like they're really preparing for it. It's not just reporting respiratory illnesses. They are making the hospitals report pretty much everything going on in there. So they are at the standard and the level that the CDC wants them to be at. And this is happening at the same time as some hospitals in northern New York are renewing mask requirements following an increase of this stuff too. And they keep saying the 19 is the big one. It says Alice Hyde Medical Center in Malone and Champlain Valley Physicians Hospital in Plattsburgh are requiring all employees to start wearing a face covering again. The hospitals are also asking patients and visitors to voluntarily cover. All right, so multiple hospitals in northern New York are also implementing similar rules and regulations for their staff and also for people. Okay, this is how it started before. It was voluntary before, and then it was mandated, and then it was some places you couldn't even go unless you had all the things they wanted you to have, right? And it says here, patients with similar like symptoms to this must wear a mask, which is standard practice. All right, so anyone that has any symptoms too has to wear a mask as well, required. And it says the move comes as infection rates increase in the area, and both hospitals report a rise in employee infections as well. And it says free coverings are available at the entrances. So they're starting to hand them out. They're starting to implement rules around this locally and also nationally. So what do you guys think is going on here? Let me know down below. All right, we could also see supply chain disruptions related to this as well too. Okay, there was a whole document that was put out a few months ago that was talking about supply chain disruptions due to another lockdown scenario. Okay, it was a continuity of business document that was sent out by the government to businesses to warn them to be prepared for any type of supply chain disruptions or lockdown situations, and to have your stockpiles and to have alternative supply chains. Start building these things now and be ready potentially for any type of disruption, right? That was a continuity of business document sent out just a few months ago, and it was talking about this exact thing. They're saying there could be another health crisis. That's what the document was saying, and there could be more lockdowns, right? So that's what they're warning businesses of as well too. I made a whole video on this. And it also says here that what the CDC is doing, right? This is a little section, part of this release from the CDC. It also says this data that they're forcing hospitals to now report will complement data that CDC already collects and disseminates from other sources such as wastewater, laboratory, and emergency department data. It says these data sources support robust systems that detect and monitor threats, keep the public informed about threats in their communities, and inform respiratory disease forecasting efforts. It says through the National Healthcare Safety Network, CDC will work with hospitals to provide training and technical assistance to ensure they are ready and able to meet these updated reporting requirements this fall. All right, so the CDC is going to be actively inside of these hospitals as well through the NHSN to train these hospitals and to train personnel. I'm telling you, they're going to have to like hire a whole person just for all these reporting requirements. This is a major step for the CDC to do this, okay? So they're going to be in the hospitals training people and providing technical assistance as well and getting them ready. What's going on here? All right, this is a big move by the CDC and the Biden-Harris administration. It also says here, these datas are critical to help with public health coordination and keeping patients safe by informing strategic planning and coordination of public health responses. Right? That's what they're going to be. This is part of the same release. This is what they're going to be training them. So also training them on coordination of public health responses, enhancing disease surveillance and early warning systems by helping identify trends and patterns of spread, and also improving healthcare delivery and patient outcomes through patient-centered care. All right, that's what the CDC is saying they're going to be doing inside of these hospitals too. So they're going to be on top of them. It's going to be mandatory and serious for these hospitals to do it. They're not going to be able to get away with just not really reporting it. The federal government is going in and saying, look, we're going to make sure you're reporting these numbers. We want these numbers right now. So what do you guys think is happening? Let me know down below. Please just hit it up for me down there to help get these warnings out. I appreciate that. It just helps guys to break through the algorithm so people know what's going on, right? This is one of the plays that is being set up potentially for later this year. So make sure you are prepared and ready. Stand firm, stand strong, be ready for what comes next, right? Have some preps and some stockpiles, because in the early days of this stuff, there was major supply chain disruptions, and we're still dealing with these disruptions now. And if we see more clampdowns and lockdowns like this, we could see businesses shut down. We could see international trade or travel shut down, disruptions along that way. All right, we just had schools shutting down. This happened a couple weeks ago for this exact stuff, right? They were shutting down schools. I think it was in Alabama or Louisiana. I don't remember. I think it was Alabama. They were shutting down schools down there, okay? Because they were saying that there was a big outbreak spreading. So what do you guys think's happening? Make sure you're getting prepared. I hope you guys are getting ready on your homestead too. That's going to be more important just going into the future, because if we do see these disruptions, at least you have eggs coming in. At least you have a garden growing. At least you have something there to fill in the gaps for these disruptions. All right, so thank you guys. I hope you have big blessings for your life, your family, and I hope you have a big old blessed day.